Okay, so. Okay, so first of all, this will be pretty informal, and we'll talk about the pretty much the project in terms of signing up for grouping yourselves, figuring out a topic, and what we need to do. Um, let's see here. Oh, there's a transcript. Everything I say is being typed in the. That's awful. And there were some great ideas on the forum that I set up at your request last time. So if you haven't done that yet, we'll talk about it briefly, but I highly recommend you go back and take a look at that. So what I am going to try to do tonight is, once everybody seems to have hopped in, I hope to set you up in breakout rooms, and they look to be very different than they are in Zoom. So I think these don't allow you to shuffle, because I wanted to be sort of like speed dating for groups figuring out who they want to do a project with. And I was going to move you around into breakout rooms. And I know some of you, the DNP students, this does not apply to you, but you still could get interested and make suggestions, So some of you probably have the experience to provide them with some real guidance in terms of what you've learned on your DNP project journey. I want to make sure everybody understands the project is primary care. So it should not be, it's applicable to, it needs to be done in a primary care setting. And so you can work together as groups of an area of interest without you all being geographically in the same area. There's no reason why not. We've done a lot of things remotely in the last year. It might be that, let's say Cassandra had a clinic where she was at, in her most recent setting, and identified something that they were interested in, and perhaps that office manager or whoever's in charge there had expressed this thing. So between all of you, the hope is that you've found a practice that would be a good place to try this out on. I will approve the topics because I want it to be narrow enough that you can actually do it and implement it, design it, implement it, because if you want world peace, you'll be here, forever. So we need to really hone it down, and that's pretty common. But some of these ideas were really actually quite concrete and concise. So I think a lot of these things will work out really well that you have. I'm looking at the second screen right now. So that's one thing. It's to be, we always say the triple aim, but now the quadruple aim is to include the provider experience too. So I mentioned last time that I believe that we were together, a project that I found that was just simple and straightforward, but very impactful, was a group that had access to I don't know if it's a federally qualified clinic or not, but an underserved population area. But they were actually focusing on the providers, because that's the fourth with the quadruple aim is the provider experience in the time of COVID. And I think I had mentioned this to you guys. So they found an evidence-based intervention that had to do with creating a space, which I'm shocked they had space, because most of us who are primary care we don't have a lot of extra space to just dedicate a small meditation room, but they happen to have that there. And they had found an app that I believe was free. And they taught them a little bit about mindfulness, and they implemented it. And I don't remember if they kept logs. It was sort of self-paced. And that being the case, then they were able to, do it on their own time when they got there. They didn't have to do a bunch of things together. And they had a pre and a post questionnaire. And in whatever data you might collect, it must not be, you must not have identities there, because I don't want us going to IRB jail over this, so you want to make sure that whatever you choose to do when you collect data, it's all there. There's no identifying factors in who you're. And so, for example, in a project I had done once, if I had said we had one office manager and 3 medical assistants and 1 physician, we would have known who the physician and the office manager was. So I couldn't provide that kind of data when I did write things up. So it just has to be, you have to be careful. And that's the other thing we'll look at, is if I see something that I'm concerned that could be the case, then We'll talk about, getting a hold of IRB and making sure it's okay, but most likely we'll just make sure to design it in a way that makes it definitely quality improvement. It's not to generalize and create new knowledge, and definitely there is no identifying information. We can't identify who the participants were. So it needs to be an evidence-based interaction. So I just did respond to somebody's on, I think it was trauma-informed care education. That's probably it. There must be just a ton of information out there about that, and then also DEI training. I think there's a lot of stuff, and so what you're going to look for is and I think all of you have librarians for your specific programs that can help you with that search. Don't create a lot of work for yourself and spin your wheels on an inefficient search for a evidence-based project, and also some of the background information you'll need to create your executive summaries and support while you're doing this. But so make sure you use your librarians. They will save you a ton of time, and I don't think there is one of you that has a lot of extra time to just waste on that, unless you just really enjoy doing literature searches that way. But you need to just find something perhaps that somebody else did in another setting, for example, and their outcomes were fine. So what they had an improvement in mean scores of whatever their scale was, and that you're going to have to adjust it because your setting is not going to be the same. And that's the thing about quality improvement, is we don't adhere to the same exact variable and control that you do in a study, because we don't have the resources, possibly, if somebody had a really nice grant, for example, and also your setting is just different. So you need to be, you're going to have to adjust what you read about, that it was evidence-based for your setting, and then you just talk about that later on. So the other thing is, so think about some of the sites you've worked at. They do need to be primary care. It can be like a counseling center or something too, though. It does not have to be, that's still really equally important. And then also just a heads up, the University of Michigan social work students work on those big projects together. And we had been working for some time with U of M over that, and it was just really going to be too complicated to take somebody who's not part of that project they've already been developing and working on from AHEC scholars and throw them into a site where they are actually for their clinical sites for their program right now. And in fact, I met with one student and a couple people from the organization where they were from, and they're like, there's no way we could do that. So that, I had hoped we'd some way be able to put those students together with other disciplines, other health professions, to collaborate with them. With the U of M students, just what they have to do to meet the AHEC scholars. There are some documents which are not new documents from what we've already discussed, but if you're a U of M social work student, you'll stay with your original group. You will need to speak to interprofessional collaboration, because you just cannot possibly create, and those are pretty detailed quality improvement projects. They're more so than we do with AHEC scholars. You couldn't do that without working with another profession, because it usually requires somebody of another healthcare profession of some sort. So you just need to talk about briefly in your executive summary the interprofessional education, our participation, collaboration. That's really pretty much it. So if any of you are from that, from the U of M social work group, this is really pretty much centered on that, and you're welcome to stay if you want to listen in and get some advice. So for instance, I think it was the DEI training. Somebody had talked about that. Is Kendra here? And then a couple people said, yeah, I'd love to do that. And then she had commented that as of recently, that we're not going to be doing that anymore. So collaborating with each other, but it doesn't mean you couldn't perhaps learn some things from them and pick their brains if you're interested in it, and create another group to do exactly that thing. So the things I see so far And same thing with the DNP students. If you want to stick around to go through the speed dating kind of thing that we're going to try to do tonight, your input would be very helpful for the other students, but you're not required to stay and do that part. So what I've seen so far is DEI training, trauma-informed care education. I think it was prep education for primary care providers for prep. Then there was vaccine information, and that one had to do with children being behind in their vaccinations, and parents did not really understand the diseases and the things that that they were preventing if they keep them up to date. So, and that could evolve into a lot of different things. I think that was from a pediatric nurse practitioner student, and I think that's another great one. And let me see what this one was. And Hannah, you said you'd be open to many. Okay, I thought maybe you had something on there. So just bear in mind that those are some of the things that I already discussed. Let's say theoretically, I don't know how many students we have because I got to factor out the U of M social work students and the DMP students to figure out exactly. But let's say we have 50 students. That's just a guess. I don't know. Who do a project, and let's say you divide it, obviously we need probably maybe 10 groups. So in order to do that, you can collaborate with up to 6 people if you want. But after that, it gets a little unwieldy, and I think that it's hard for everybody to do their share. Okay, so we'll talk about that and come back together. But in the meantime, what other kinds of questions that are unrelated to this practice transformation grouping and picking a topic? Anybody have questions? So it looks to me like several people are on time. And did Dr. Telemingris's module and the quiz that went with that and did well. The module after that is one I put together, and there are some great. There's an ARC document in there. And it is all about primary care, safety in primary care. So that might be transition in care. So for example, that would include, the person who gets discharged from McLaren, but you have practice with Ascension, and then you might not, they get out of the hospital and meds have been changed and you don't really know for sure because you have not gotten the information from the hospital yet. Although from my limited experience from the area I worked in, McLaren did actually a pretty good job communicating that stuff. But so that would be a patient safety thing. And so a transition in care would be one thing. That's sort of a big thing for people to solve. But if you poke around the website and the document that I have set up for you guys to read, they actually have some quality improvement projects in there. There's no reason for people to reinvent the wheel. What I want you to do is to understand how to research it a little bit. The epidemiology, the impact in terms of, is it a safety issue in terms of health, morbidity, mortality? Is it a cost savings? Things of that nature. And also, what percentage of the population does this have with? So, 20% of people who are discharged from the hospital, for example, have been demonstrated, I'm making this up entirely, have been demonstrated to not have, the records have not been sent to the primary care provider at the time of their first visit from the hospital. I don't know what that number really is. I'm guessing from my own experience, it was probably higher than 20%. There's a lot of stuff in there too, just so you know, and there aren't as nearly as many modules as you had in year one because you got the bulk of those core modules in, and then we're really focusing around practice transformation. There's also some communication, risk communication, which is very relevant to what we've just been through with the pandemic and how you get things out there and whatnot. So you have a few other things to do, but I would get working. If you're working on a topic, I would get in and start delving into some of those ARC documents and websites and stuff. And it might help make that a little bit easier for you also. So if you find something the federal government has established that this is the blueprint for a project, I am fine with that. You don't have to, they've already done the background work. They already know it works. It's evidence-based and whatnot. And if you think, wow, this would really work, or taking a piece of it, just a small part that you can customize for your particular setting and their needs. And it also has to be something that the people in the setting you're looking at would be interested in, and that they're behind it. Because one of the things about any kind of organizational change and behavior change of group of people is you have to have buy-in from them. They have to want to do it. So okay, so any questions beyond that about the course that I haven't covered? All right, I am gonna try my best to put you in breakout rooms. How many people do we have here? Looks like a few. I have 1, 2, 3, 4, 5, 6, 8, 10, 12. I think we have around 16 people, which is pretty good. That's more than that signed up for it. Excellent. All right, I am going to try to break into breakout rooms. Oh, there it is. Well, the icon that they set on the YouTube video that was just published less than a year ago is not here. Can I look somewhere else? Oh, seriously. I don't want to share content. Well, that is not going to work. We must not have paid for all the bells and whistles or something here. Yep, we're not going to be able to do that. That's too bad. I wish we had done this by Zoom. I guess what I would like then is for anybody who is here for the group that was talking about practice transformation, the DEI training. Kendra started it. Vivian had expressed, sent a message, and Kimberly talked about it. Dora. Oh, it's the U of M students. So is anybody from U of M on that DEI thing that might want to just talk a little bit about it for the students who might be interested in forming a group that would do something similar?
Yeah, I'm in that group. Hi, everyone. My name's Maya Arsenault. I use she, her pronouns, and I'm on that team. I'm on the DEI group from the U of M social work students. Basically, what we have done is we took one of our agencies. So it's actually the agency that I intern at. It's called Development Centers. It does integrated health, and I specifically work with the mental health aspect of that as a social worker. And so we really had an idea that we wanted to help them with their DEI training, their diversity, equity, and inclusion training, because I had heard just through different people in the agency that a lot of people were not getting training that was super helpful for them, and specifically to work with populations in the LGBTQIA plus community. They felt like their trainings just weren't really meeting the bar and getting consistent trainings throughout the different disciplines, right? So the nurse practitioners that we work with weren't getting the same trainings that potentially social workers were, and the doctors that we work with, et cetera, et cetera. And so we took that and we created a survey that we sent out to all of the staff at development centers that just asked different questions about their level of education that they have on these trainings, their interest in these trainings, and how they think it would impact their clients. And so then we took that feedback and were able to apply for a couple grants and partner with a local agency that specifically does DEI training for the LGBTQIA plus community. And we actually just found out a couple weeks ago that we were approved for a grant. And so we're hoping to yay, thanks everyone. We're hoping to kind of set development centers up for success and connect them with that resource to get them that training.
Very nice, thank you. Does anybody have any questions for Maya? So I think you might not be doing something that you need to get a grant for. And I will tell you, there are some recommended deadlines to get certain things done and what I only started AHEC in January, but what happened the past year with this year or two is that they implemented into the winter semester. Doesn't mean you can't try to implement sooner, but that was one of the reasons the U of M social work students weren't going to work out well. So that's a great discussion, and we won't expect you all to be getting grant money. Maybe we can come with a simpler version of what they're doing. So it doesn't have to be big. You're not looking for a huge survey. Just if you're working with a small office, that is fine too. But it sounds like a great project. It really does. And I was thinking as you were talking, Maya, is that you might look at some, not you specifically, but I meant the group might look at some of the organizations that there are here in the Detroit area. I don't live in the Detroit area. I live in northern Macomb County, for example, and we have a brand new chapter for northern Macomb NAACP. It's a brand new chapter, and I joined it, and there's a health committee, and I'm on the health committee, and one of the things we're looking at is the vaccine hesitancy. It's no different here in this little village that I grew up in, and it's really called a village, by the way. So I feel like a villager, but that vaccine hesitancy is the same here too. Certainly it's not as big in terms of numbers, but you might think of some other opportunities like that where you could help out a little bit and help set somebody up for success. But the idea is to look at population health in a community primary care setting, but definitely if it's a community effort that really better fits what your population, where you might actually get them at. I know they say barber shops and churches and things like that, and hair salons. That is certainly something you could, talk to me about. We can figure out if there's a good way to do it. So, let me look up the other ones here. So anybody here who had talked about the prep education for primary care? Anybody on that one? No? Okay. So there is, look at the forum in Moodle, and it's actually, I find Moodle pretty not intuitive. I'm pretty good at Canvas, but I'm not good at Moodle at all. But I found this not hard to find, and it wasn't hard to respond to. So I'm a fourth-year medical student at it must be Western Michigan University Medical School, going into pathology. I'm working on any type of project, but one thing I think would be particularly interesting would be related to assessing the need for or in implementing prep education for primary care providers. And I will tell you, there's a possibility. The practice I was at for 20 years is there. We didn't get any prep training and whatnot, and they've just brought in a new physician. She's just out of a residency and brought I think a big population of patients with her from the Mount Clemens area. So I could find out if we have a group of 4 to 6 students interested in that. But you'd want to be sort of at least have somebody located in Macomb County, or close enough by they wouldn't mind making that kind of drive. But think about doing something like that. I think that's a great one. Although the younger, newer physician probably is much more up on it than the physician who's very good. I'm not. It just we were older clinicians. So, and then the vaccine. Where did that go to? Up at the top. Hannah, did you want to talk about that a little bit?
Sure, I can kind of talk about it. It was just kind of like a rough idea. We didn't have a concrete plan yet, but we are in the PEDS primary care program, and we were just like noticing how tons of kids have no education on what their vaccines are even preventing them from getting, like how some help you not get ear infections and pneumonia and stuff like that. We were just trying to think of some little education thing that we can do to educate them on that, so they're a little bit more in the loop with their care as kids.
So, and the certainly the Michigan Department of Health and Human Services has a lot of resources, and I think a pretty robust group of people in terms of vaccines. If you guys want to do that and you want to talk to somebody, I know somebody who knows somebody, so I could at least get a contact information for you about who she knows, if if you want to do that. So the idea is, my preference would be to see, certainly minimally it has to be 2 people from, or at least one other person from a different health profession. It'd be nice to see it be a little bit more distributed, but if you decide you want to have 3 different professions, that's great too. The more the better. All right. Since my speed dating thing didn't work, that really was what I was going to do. And who is new here that didn't come to the first meeting, that maybe you could introduce yourselves, show me your faces? Megan popped up. Okay. Go ahead.
I wasn't able to come to the first meeting. My name is Megan. I'm a 4th-year med student at Western Michigan.
Okay.
Hi.
So you probably know the person who brought the prep up. I don't remember the name. I'll have to look for it, but go ahead. I'm sorry.
Oh, no, nothing else really interesting. I'm going into family medicine. I want to do rural and community family med. So
awesome. Perfect. Yeah. So,
thanks.
Yeah. I sort of think that was that would have been one of 3 medical students from Western Michigan. You weren't one of those 3 that were talking about the trauma-informed care then, is that correct? Okay. No? Okay. All right. Who else was not here that could introduce themselves? Elaine?
Yeah, hi, my name's Elaine. I'm another student at Western Michigan University, a 4th-year student, and I am on the group that is looking into trauma-informed care. I don't know if you want me to talk a little bit more about that now. I tried to give a good description.
Yeah,
okay.
That'd be great.
Yeah, so I'm working with Rachel, who you also see on your screen, and a couple other medical students at Western Michigan. We were talking about, this is also still in the early stages, but we were talking about incorporating trauma-informed care in the primary setting. And so for those of you that don't know, ACEs, or adverse childhood experiences, those have a huge impact even going into adulthood on health outcomes. And so at least when I was in some of my primary care rotations, I didn't see a uniform way of asking patients those questions that are very important, and that can very much impact care. And so we were kind of discussing ways that we can discuss with providers, like survey providers, how they incorporate trauma-informed care and ACEs into their current practice, if at all, and then trying to incorporate like an ACE survey for patients or some sort of education in that way, and then resurveying providers. So that's kind of our basic idea. And since this is currently a group of medical students, so we're still looking for any multidisciplinary people that want to jump on. So feel free to let us know.
And they don't need to, once again, don't need to geographically be by near you, because people can certainly help with the project and not have to be there at the site. You don't really want to overwhelm the sites anyway with, 6 students standing around anyway. So I think it sounds like a great project. And I suspect there are a lot of options. One thing was, my thought was, because we all want to see one more quality indicator metric pop up on the screen, but to incorporate it with IT, although a lot of times that's sort of hard to accomplish. They don't always want to add something to it. So very good. All right, somebody else speak up here. I'm trying to see. Matthew, were you here last time? I think you were, no?
I was. I'm going to be working with Elaine and Rachel as well, but we're looking for more people to join us.
Yeah, you need at least one other. So, okay. And then is it, I don't want to mispronounce your name. Is it Anne? Anne? Antu?
It's
Anti?
on, but that's totally all
I'm
right.
so sorry. Yeah, I'm really bad at that. Thank you, Anne. Can you introduce yourself
No,
then?
that's fine. I will apologize if my connection is kind of,
Okay.
yeah, my connection is kind of slow. My name is An. I'm currently a fourth year pharmacy student at Ferris State University, and I'm still looking for a group. I will be open to anything.
You might be a good person for the group doing something on prep. I think, that would be a perfect place for you. But if that's not your interest, don't feel pushed into it either. So, who did I miss here? Hi, Gina. You're waving. Unmute. No? You're muted. I don't know how to fix that. Anybody? Gina, I can't help you. So, anybody else? Even if you were here, you're welcome to introduce yourself again.
Can I jump in?
Yes.
I forgot to make this plea. Sarah, Gina, and I are gonna do COVID education project.
Okay.
And we are all med students, so we're looking for anyone willing to join us. There's some pharmacy in it if you're interested.
I'm not sure how many pharmacy students. They're usually at a premium. You may have to pay a lot of money for that now. So, but yeah, I think that what are you looking at in terms of COVID education? I'm curious.
I can talk more about that.
Okay.
So we were going to a local rural clinic, hopefully one down in Three Rivers that I've worked with before. And we are going to give the providers and staff there a survey about their level of comfort with COVID-19 vaccination education. And also the patients, if they feel they're being adequately educated, should they want it in the clinic. And then the National Rural Health Association actually has a kit for COVID-19 vaccinations that is specifically aimed towards rural populations. We were going to hopefully use their education kit, implement it, and then resurvey and see if people feel more comfortable with that.
Perfect. Yeah, it's great. So yeah, I love that. Very good. Yeah, you don't need to reinvent the wheel. If they've got a kit for you, use it for sure. Okay, nobody seems to be clamoring. This is your last call. So
I can introduce myself really
Okay.
quickly.
Great.
Sorry, I'm on night duty right now, so
Okay.
I apologize. My name is Rachel Chang. I'm also a fourth year medical student with Elaine and Men. We're all kind of doing the ACE Center Trauma Informed Care Education thing. I look forward to working with some of you for whoever's interested. So it'd be great. Reach out.
Okay, thank you so much. All right, I'm going to let you guys go. Thank you so much. Oh, there's something in the chat, I think. Did I not answer somebody's question in the chat?
My hand was still raised. Sorry.
Oh, okay. So you're not feeling neglected. All right. Very
No.
good. Okay. All right. Keep me posted and start reaching out to each other. I will. This is recorded. I'll post it, and hopefully it'll stimulate some other people to participate. And if you're having a hard time finding somebody, if nobody's volunteering to be on with your group and you're looking for another health professional, let me know that remains an issue. Okay, you take care. Thank you for coming. All right. Bye-bye.
Thank you.
On that
Thank you.
topic,
Bye-bye.
if it's okay, I'm going to stick
Yep.
on. If anyone wants to talk more about our project, please stay on if you're not a med student.
So if you're interested and you're not a med student, hang on. And then I'll just mute myself and step aside while you guys chat. How's that?
Thank you.
All right, very good.
Hi, Ann.
Hi, Megan and Sarah and Gina.
Gina, for some reason, can't seem to unmute. So she's here, but she's quiet.
And she's quiet in real life too. It's not that big of a change, right? And my mouth is just too open, so I'll make up for it. Yeah, so I saw that the National Rural Health Association had this education kind of set up. They have posters and pamphlets and provider education and all this other stuff that you can get through them. And I was like, well, that sounds like an easy way and a pretty pertinent thing to kind of get after at the current time. Yeah, I just recently came up with it, so we don't have like any like nuts or bolts with that or anything yet.
So what are we thinking of doing? Like poster and like something. I'm sorry, I cannot pronounce today. So poster is one of the things that you guys are planning to do?
So it would be a survey for both patients and staff at a clinic about their level of comfort with the education they get about COVID-19 vaccination and COVID-19 potentially. We would survey them, see how comfortable they are, and then we would use this toolkit that the NRHA came up with that has posters and brochures and just educational materials, and put that into the clinic, make sure all the providers, MAs, whatever, are comfortable with it. And then we can let that simmer for a little bit and then resurvey them, say, hey, are your MAs more comfortable? Are your providers more comfortable? Are your patients more comfortable with the education they're receiving regarding this topic?
Gotcha, thank you. My connection is bad, so earlier, like it was breaking for me, so I couldn't hear very well. Let me know if you cannot hear me. I can type.
No, you're coming through great. And kind of the one other nice thing about our project is that we are both pretty hooked up with our community as far as rural primary care. So we could most likely do it in our community if that's okay. It wouldn't be something, that we'd have to put on you or put in another community.
Yeah, I could help create the survey if you guys haven't already done so. Are we thinking of question poll for the survey, or like another website, or Survey Monkey?
Probably a paper questionnaire, at least for the two clinics that I'm thinking of. Just because they're not super hooked into the electronic world.
Sure, yeah. Okay.
Unless you think Dr. Brummer's...
Right now, my mind is just blank. Yes?
Would that be okay if we got like your phone number so we could start a group chat to kind of make sure things stay rolling?
Yes. I will type it here.
What?
Perfect. Thank you. I'm going to text you right now with my name and everything.
Do you receive a chat?
Yeah.
What? I'm locked out of the chat because apparently I'm not a member of the team.
Oh, weird. So my number is 616-318-0211. I just got your text, Sarah Jo.
I'm gonna create
and I'm pretty sure I can get Meg.
Yeah.
I'm pretty sure I can get Megan's number from you.
Mm-hmm.
And Gina's too. Okay. Yeah, so right now I kind of blank out on a lot of things, so I cannot really think. But I definitely will have some ideas for our surveys.
It's not like a whole bunch I don't think that we need to flush out right now. We just it's nice to know we kind of have a complete team.
I'm creating a group chat right now with all you guys. Megan and go. Okay. There we go. You guys got that?
Yes.
Cool. Then we can keep in touch, and as we go along, we can figure out
Perfect.
exactly what we're doing. Because I literally just saw this email a couple days ago and was like, "Oh, they have a toolkit," and made it up in my brain. But cool. Thank you so much, Ann, and thank you so much, Megan. I love you.
Good night.
Have a good
Good night,
night,
guys.
Bye.
Bye.
Bye.